Well, I'm so excited to have everyone here. Thank y'all so much for joining us. Before we get started, just wanted to know where people are joining us from. There is a little chat at the bottom. You can type in there. I'm in Atlanta, Georgia. Shelby, where are you joining us from?
I am in Puerto Rico right now. Very excited to be here. Yes.
So we've got South Carolina, Florida, and Toronto, Ontario. How awesome. Well, thank you all. Oh, that's South Carolina. Well, thanks guys for joining us. We're so excited. I'm Ashley. I am the nurse practitioner at Let's Get Checked, and I will be the host for this evening, and I'll be presenting as well. And then we have the wonderful Shelby with us. I'm so excited to get to pick her brain and learn a little bit about sex and relationships. So Shelby, if you just want to introduce yourself a little bit.
Yes. Hi, everyone. Thank you for joining us tonight. I'm so excited about this event. I think that everything we're talking about tonight is so relevant. I'm always happy to be discussing these topics. I am a love, sex, and relationship coach based out of New York City. And yeah, all of my work revolves around pleasure and also communication, making sure that people are able to discuss all of these wonderful, but also scary sometimes topics with each other so that they can have the best relationships possible.
That's great. Thank you so much, Shelby. We're so excited to hear what you have to say. All right, well, let's get started. So first things first, I just want to introduce Let's Get Checked a little bit for anyone who may not be familiar with our company. We are a digital healthcare solution. We offer over 30 health tests directly to your home. So you could go on your app or website, order a health test. It's shipped to your home in a discrete package. You can take it sent to our lab, and you'll get your results in about 2 to 3 days. So very quick, and we do offer treatment off the back of some of these tests, and I'll go over that a little bit as we go. If you'll go to the next slide for me. So this is our agenda. Just a couple things. First, just talking about some of the myths, facts, and things we want to make sure you know. We want to answer any of your STD questions. Please feel free to type in the chat at any point. We'll be popping in, trying to answer your questions, but at the end, we'll also have a Q&A section. So we will be answering your questions. So make sure if you think of anything, don't hesitate to put it in the chat. What is a healthy sex drive and relationships, communication, and intimacy? Shelby will help us with all that. And then we'll talk about some actionable next steps you guys can take to make sure you're having the best sexual health possible. So first things first, let's talk about a few myths and facts that you may have heard about STIs. So this is true or false question. So feel free to answer your answer in the chat, true or false. No judgments if you don't get it right. We don't expect you to know all these things. So first one is females are less likely to contract STIs. Is that true or false? Good. Seeing lots of falses. This is correct. So women or females are actually more likely to contract STIs, and it's because we're just more vulnerable. We have more tissue. Our vaginal tissue is much thinner. So it is makes it much easier for us, unfortunately, to get infections. So very, very important to keep that in mind. 2, over 1 million STIs are contracted daily worldwide. Is this true or false? Great. I am seeing some truths. One false question mark. So this is true. So you'll see that STIs are very, very common. They're happening all over the world, but also, of course, right here in the US. We'll go over a couple statistics too, but very common. So we want to make sure you guys are as comfortable as you can be talking about it, and that you have some knowledge about the STIs as well. Number 3, chlamydia is the most commonly reported bacterial STI. Is this true or false? Yep, it is true. Trichomonas and chlamydia are probably 2 of the most common ones that we see. They're both easily treated with antibiotics, just oral antibiotics. So, and they're usually most common in people around age like 20 to 24. But number 4, STIs always cause symptoms. True or false? Good. Already see. Yes. Great. Okay. So this is false. In fact, most of the time, it's probably about 50-50 if you're going to have symptoms or not. It really does kind of depend on the infection. So some infections are more likely to cause symptoms, but for the most part, a lot of these STIs, gonorrhea, trichomonas, chlamydia, you're not going to know that you have it just with symptoms. So very important to be getting regular tests for these. And we'll talk more about that in a little bit too. All right, next slide. So how common are STIs? Very common. The CDC estimates that 1 in 5 people in the US currently have an STI, whether it's something that you were diagnosed with a long time ago and you're managing something kind of like herpes or HIV, or an acute infection like chlamydia or gonorrhea. So that's why it's just so important to be informed about your sexual health, but also to not feel ashamed or judged. And that's really, I know our goal, I know Shelby feels very passionately about this as well. We want to make sure that you are getting any of your questions answered and that you feel comfortable speaking with your healthcare providers, speaking with people about your symptoms, and never feeling judged or marginalized because of your symptoms or what STI you may have. Next slide, please. All right, so we're going to go through a couple of common STIs. I just want to make sure you guys have a good basis of these. I don't want to bore you guys to death, and I'll try to be quick, but I just want to make sure that you guys have some good base knowledge. So first is HPV, or human papillomavirus. This is the virus that's linked to cervical cancer. It can also cause penile cancer in males. It can also cause genital warts. Very, very common. So it's estimated that about 1 in 2 people will contract this in their lifetime. A lot of people will actually clear this on their own. So, but if it isn't cleared, it does have the risk of developing into the genital warts or cervical cancer. There is not a screening test for HPV for males. However, for females, when you get your pap smears, usually around age 30 is when the HPV test is paired with that pap smear. Just depending on your results, you'll get it, usually about every 3 to 5 years, but maybe more frequently based on your results. So very important to make sure you're up to date with that. There is a vaccine for HPV as well. Next one's chlamydia. We talked a little bit about this. It's very common. It's the most common curable bacterial STI in the world. We do provide treatment for this through Let's Get Checked. So if you did test positive for this off one of our tests, we can provide you treatment, and it's very easily cured with these antibiotics. Next one, gonorrhea, also very common. Not quite as common as chlamydia. It does usually coincide with chlamydia. A lot of people who have gonorrhea will see they also have chlamydia as well. Gonorrhea is a little trickier to treat. It requires an injection called Rocephin. So unfortunately, we cannot treat that through our platform, but we of course do test for it. So we can give you that valuable information that you can then go to your healthcare provider for treatment, or even a free STI clinic could give you treatment. Next slide, please. All right, herpes. So this is, we're talking about HSV1 and HSV2. So HSV1 is the one that we're thinking more about, like the cold sores. You may get a little sore around your lips. And then HSV2 is commonly associated with genital herpes. Now, that's not to say that you can't get HSV1 in the genital area, especially as someone with an active cold sore, you have oral sex, you could get a breakout, and then vice versa. So HSV2, you can have breakouts in the mouth. But in general, that's just kind of how we differentiate them. We do have an antibody test for HSV1 and HSV2 through Let's Get Checked. It's a blood test. Next one is hepatitis. So there's several different forms of hepatitis, but the one most closely related to sexually transmitted is hepatitis B. This is a viral infection that can infect your liver. We do have a hepatitis B test. It's a blood test. It's linked with your hepatitis C test. So hepatitis C is usually a little more associated with people who maybe use IV drugs, but it's still very important to check for both, especially if you're an IV drug user, if you're having frequent intercourse with multiple partners. Very important to at least check for this every now and then. And then syphilis. So syphilis is on the rise, and congenital syphilis is also on the rise. So congenital syphilis is when a pregnant woman gives it to her baby. We saw a rise with this during COVID, and it's likely because people were not doing as much screenings, I think. what it starts with is it's a primary stage. So it starts with a chancre, which is a painless sore. It can also just be kind of a rounded, kind of a bumpy area. So it's not very specific, and this goes away on its own. You don't have to have treatment for the sore. And then you go into the secondary stage where you may get a rash. It could be all over the body. You might have flu-like symptoms during that time, but that goes away. And then you can go into the latent and tertiary stages. The most important thing with syphilis is even though those symptoms are going away, until you have treatment, you're not truly treating it. So that's the problem with syphilis is oftentimes people may get these symptoms, but they end up going away. So they may not talk to their healthcare provider about it. So very important to make sure that you're including syphilis in your testing. We do offer syphilis testing through Let's Get Checked. It's a blood test. Our syphilis test is actually considered a screening test. So it's checking for antibodies. So you would need to get confirmatory testing if it's positive, but it's a great start to see if you're at risk for syphilis. So next slide, please.
Ashley, I know that there was a question in the chat if you want to see.
Perfect. Thank you, Shelby. Will you go over the best way to not spread HSV2? Great question. So it just depends, male condoms, dental dams, making sure you're using, if you use sex toys and someone has an active outbreak, especially make sure you're using condoms even on those. I do want to emphasize though with HSV too, if it's a genital outbreak, if you have sores that are not, directly in the area where the condom or the barrier where it's not covering, you can still spread it that way. So probably best if someone does have an active outbreak to avoid intercourse during that time. There is a chance that people can spread genital herpes even without the active sores. However, it is a little less likely. So I would encourage that. But if you do have that barrier on, it is less likely to spread. So there is treatment. So that's on the slide for herpes. So people who do get herpes outbreaks, there are antiviral medications you can take, and they're quite effective. For people who are getting more frequent outbreaks, there is daily suppressive medication you can take that can decrease your risk of transmitting it to your partner, but it can also decrease your the number of outbreaks you're having per year. And we'll usually consider those in people who are having about 6 outbreaks a year. I do want to make one caveat there though. If you find that you're having a lot of herpes outbreaks, we want to make sure that you're talking about that with your healthcare provider, because you would want to make sure we're checking for HIV and other immunosuppressive type diseases, because usually in people with healthy immune systems, we wouldn't see that many outbreaks. It's certainly possible, but just something to make sure you're talking to your healthcare provider about. So like I said earlier, bacterial infections are easily treated with antibiotics. So gonorrhea, syphilis, chlamydia, and trichomonas. One other caveat with syphilis, it's going to be an IV antibiotic, so we aren't going to be able to treat that through our platform. But like I said, we do test for it. But our test is testing for the antibodies. So even if you had syphilis 10 years ago and you were adequately treated, you would still probably test positive on our test because it's the antibodies. So that's something important to keep in mind with our test there. Does the medication damage your kidneys? Not likely, especially if you don't have a history of kidney dysfunction. Of course, that's something we always ask people before we get them started. But it's valcyclovir and acyclovir are 2 of the medications that we give for herpes. I think that's what you're referring to. Those are relatively very safe medications, especially in people who normally function kidneys. In older populations, we may decrease the dose just because their kidney function tends to decline naturally as you age. Other medications, though, antibiotics, the ones that we use are usually pretty safe. If there is anything that we think could possibly be problematic for the kidneys, we always make sure we're asking people to make sure that they don't have a history of kidney disease. So that is something we always make sure to ask our patients. So good question. HIV, it can be treated with antiretroviral medication. So it's not a cure, but it does help to decrease your viral load so that it's less likely to transmit to your partner, but also so it's less likely to to progress to AIDS. So very important for people who have HIV to be taking their antiretroviral medications. It's going to help decrease the comorbidities that can come with HIV. PrEP is a medication that can be taken, so you don't have to have HIV to take PrEP. It's a wonderful medication. You can take it to actually help prevent the transmission of HIV through sex and IV drug use. So very important if you are concerned about that. There's a lot of different PrEP clinics around, so just make sure you can speak with your healthcare provider. There is periodic testing that has to happen when you take PrEP, but it's a wonderful medication, so just make sure that you're aware of that. And then again, syphilis, gonorrhea, chlamydia, trichomonas are all curable if you take your antibiotics.
Ashley, sorry to interrupt. I have another question.
Yeah.
So this is a personal one, but I'm curious, like sometimes when I go to get STI testing, my gynecologist or my provider won't always test for everything, even if I ask them to. So how can you, like, what's a proactive way to make sure that you're covering all your bases?
Sure. So we do offer with Let's Get Checked very broad. We test for, there's one where we test for 8 different infections. So ureaplasma, mycoplasma, we're testing for Gardnerella, HIV, syphilis, chlamydia, gonorrhea, and trichomonas. So 8 of those. So you can always get testing through us, but if you certainly want to get it from your provider, I would ask them. Sometimes there are reasons we're not testing, like for instance, if you're not getting your HPV check every year, that's because we don't want to over screen for HPV. And the reason is because a lot of people will just clear this naturally from their bodies. And so we found that by testing some things too often, it can actually cause more harm than good, because then we're going and almost chasing this rabbit hole that probably wouldn't have been a problem to begin with, if that makes sense. But I always encourage people to be advocates for yourself. If your provider isn't listening to you, perhaps you need to find a different one who maybe will listen to you or test for things that you find are important, and ask them why they're not testing you if they have any reasoning behind it. That's something really important, I think, to ask. Great question, Shelby. All right, let's go to the next slide. Oh, good. So we get some questions now, a little more fun. So next slide for me. Okay, so if you have pain during sex, does this mean you have an STI? Not always. So a lot of things can cause pain with intercourse, especially for females. It could either be, this is something that a lot of people may not know, but around the vaginal area, you actually have muscles called your pelvic floor muscles. And if you've never looked at this, I encourage even males, females, everyone to go look at these. They literally are right around the vaginal area, and these muscles can get really tight. And some people, if you have stress, you can even hold your stress in these muscles, and that can cause pain with intercourse. If you're experiencing this and you've been tested for infections, you're not taking any medications, you can't figure out what the cause is, make sure you're talking to your healthcare provider. There are pelvic floor physical therapists who are fantastic, and they can help you with decreasing that pain, and they can give you stretches to help really reduce the pain in that area. So there's a lot of great things that the pelvic floor physical therapy can do. I'm a big believer in that. Some other things that could be, so infection is very common, especially if you're having like pain and bleeding with sex, because that vaginal tissue gets so irritated. Vaginismus, this is when you're having discomfort during sex, and it can be quite severe for some women. That's another one pelvic floor physical therapy can be very helpful for. Other conditions, so women who maybe are about to go through menopause, or you have gone through menopause, you're seeing a decrease in that estrogen, and that can cause thinning of the vaginal tissues, and it can cause a lot of pain. Now, there are creams that can be provided, if you are postmenopausal, estrogen creams that can be prescribed that can help with that discomfort. And then also certain medications, a very common medication people take, like antidepressants, can also cause, it can cause decreased sex drive, but it can also kind of decrease the lubrication, and it can make things a little more painful. So if that is the case, using lubricants can always be very helpful. And they have great lubricants out there that are, natural. So just make sure you're, checking into those kinds of things, because that can certainly help. If you have, I'm answering this question from someone, if you have sex with multiple guys the same week, but they're clean and so are you, can you still catch any STD from them? So someone has to have the STD to pass it on to you. So if they've, checked and they know they're clean, you're clean, very unlikely. I do want to introduce something called a window period to you guys, though, and I don't want to confuse anyone too much. But a window period is the period from when you get exposed to an infection to when the infection is actually going to be detected on a test. So that is something very important to keep in mind. If you know that, say one of your partners had gotten exposed to chlamydia, but it was 5 days ago, they may not be showing that infection in their body yet. So it's very important to make sure that you're checking with your healthcare provider, make sure you're testing at the correct times. We're always happy to help you guys with those kinds of questions. We have information about it on our website as well, called window periods. It's in our frequently asked questions area, because that's very, very important to make sure you're testing at the right time. But if you know that, no exposure, you've all been tested, then it's very unlikely, and it's very important. I'm glad you're getting tested and having safe sex. That's so important. Perfect. All right, next slide. Commonly asked STI questions. Can you get an STI from toilet seats? We'll see what you guys think. We all put this in the chat. No, that's right. You're not going to get an STI from toilet seats. They're just not going to live in the air like that. They're not transmitted that way. So don't worry about from toilet seats. Can you get STIs from kissing? So one STI you can get, it's the cold sores. Those can be passed by kissing, but unlikely to get anything else. Jerry says, woo. Yeah, I agree. Is it possible to get an STI without knowing? It is. And like we've discussed, it is possible that you're not going to have symptoms. So that's why it's so important to be testing regularly. Everyone's different. So, I wouldn't test at the same intervals as someone else. It just totally depends on how many partners you have and other risk factors. So CDC has great information on their website to help people know when they should get tested. If you have questions, but we also do, like I said, offer those consultations. We're happy to take a look at your history and let you know how often and what you should be testing for. And then is it possible to have more than one STI at a time? Yes, it is. So people who have, say you have herpes, you have these open lesions in the genital area likely during an active outbreak. It's more likely that you're going to be getting infections just because you have more open sores and open areas, more opportunities for those infections to get into your body. So you can see infections too at the same time, and you can still be treated for both at the same time. So don't worry about that. We can give you different medications and can be easily treated. All right, next slide. I think I got 2 more and then we get to hear from Shelby. I can't wait. So can STIs cause long-term damage in males? It can. So one problem with untreated STIs, especially gonorrhea and chlamydia, is epididymitis and orchitis. So epididymitis epididymis is just a little structure sits on top of the testy, and then the orchitis is where the infection is actually inside the testy itself. This would cause a lot of discomfort in the testicles, swelling, pain. If you're noticing this, make sure you're getting evaluated by your doctor. It is treated with antibiotics. So it will go away, but it does take some time and it can be quite painful. And then again, we discussed it can increase your chances of getting other infections. Next slide. Would either of these cause a scabbing dry skin? No, orchitis and epididymitis would not cause scabbing or dry skin. You could get scabbing with herpes if you have like an active outbreak. Once those ulcers heal, sometimes they'll be kind of scabby and a little dry until the skin itself heals. And like we discussed earlier with syphilis, sometimes if you get that chancre and then in that secondary stage, you will get, you can get a just rash, kind of generalized meaning all over the body. And that one can be kind of scaly and red rash, kind of just one that you may associate with almost like if you were to get contact or like use a detergent that you were allergic to or something like that. So STIs, can they affect female fertility? Yes, they can. So what we think about, especially with females, is pelvic inflammatory disease. And the two most common offenders of this is going to be chlamydia and gonorrhea. And what pelvic inflammatory disease is when this infection, it starts ascending up into the uterus and even into your fallopian tubes, which are the tubes that carry your eggs from the ovary to the uterus when you ovulate. Sometimes these infections, it can, once it gets into the fallopian tube, it can cause a lot of scarring, and that can cause problems with fertility. So very important things to look out for pelvic inflammatory disease. You're going to have a lot of discomfort in the lower abdominal area, vaginal discomfort, fever, chills, just generally not feeling well. So make sure you're certainly getting checked out if you're having those symptoms. Okay, next slide. I think it's Shelby's turn. Cannot wait to hear from you.
Okay, thank you so much. That was so informative, and I really, and just, yeah, incredible. Thank you. So we're going to go into what is a healthy sex drive. I'm really excited to talk about this. So libido, there is no normal, and I could not emphasize this enough. It's one of the most popular questions that I get asked as a sex coach and from clients. People want to be like, they want to make sure that they're having a healthy sex drive and like what exactly that means. Usually people want to define it as like, how many times a week should I be having sex, or, you know, masturbating, all of these solo sex, you know, however you want to define it. But I do want to say that there is no normal. It's really whatever is working best for you. So like it says on the slide, your sex drive can change from day to day, month to month, year to year. It's really dependent on what's going on with you in your life. There are so many factors that can affect your libido. So having some fluctuation is totally normal and like a part of it. So knowing what's normal for you is like key to help you kind of figure out how to get back on track, how to get back on balance. And again, like some people have higher sex drives, some people have medium, some lower, you know, again, it's whatever feels right to you, no pressure. And it says keep communicating. Your partner, again, might have a lower or higher sex drive than you. This comes up a lot in my work as well. How to meet your partner if you're having different sex drive levels, which is, again, extremely common. And a great way to do that as well is to communicate and to schedule sex. That's something I want to throw out there and offer. You know, sometimes we have to remember that sexuality is a practice, just like you would with any exercise that you might do, or even, you know, cooking, whatever it is, eating, brushing your teeth, all of these other things. Sexuality is a practice. So sometimes scheduling things can help alleviate the stress around initiating sex. You know, there is, you know, some performance anxiety sometimes that can contribute to low libido. So yeah, just make sure to have that open conversation with your partner, and the more communication, the better. The next slide would be great. So here are some common underlying causes of low libido. Again, there is such a wide variety. And I also want to say that, like, throughout the slideshow, the language is very gendered, you know, but again, it's whatever reproductive organs that you're having, whatever you're relating to, just go for that. You know, it's very inclusive. But for men, mental health issues, stress, anxiety, depression, relationship problems. I'm sure some people here can relate, right? Medications, this is a huge one. I get a lot of people asking me, you know, their depression medication, anxiety medication, all of these things can have an effect on your libido. age, physical health problems. Thank you, Ashley. Low testosterone for women or vagina having people, you know, again, a lot of similar things here: menopause, physical health problems, sexual problems, pregnancy. There are so many factors. So I think it's really great. As a sex coach, I encourage my clients to maintain this practice of sexuality and sensuality with them so that they know that when they're fluctuating, one, they have a little bit more grace and empathy for themselves, which I think is super important. You know, like, it's okay to have periods of not feeling sexual. I think especially, you know, I will acknowledge that we've been in a pandemic for the last 2 years. And although, you know, it might seem like we're kind of out of it now, there are still so many stressors that have been maintained throughout this entire process. And a lot of people's libidos have been affected during this time. So if this has happened, just be gentle with yourself. And it's great to seek experts to, I don't know, continue your own personal sexual journey. Next slide, please. So yes, how can we maintain a healthy libido? There are so many wonderful ways. Mind your mind. If you're feeling anxious, depressed, this can affect your sex drive. Again, like, anything that you can do for your mental health is obviously going to impact so many other aspects of your sexual career and the other. I think intersectionality is such an important thing to keep in mind through all of these conversations. And when I got into being a sex coach, I didn't realize how important this was, but really so many things everything affects each other. So the more you can do for your mental health and your physical health and your overall well-being, the better it is for your libido and your sex drive. Sleep more. I'm a big advocate of this. Libra. It's good for your beauty. It's good for your brain. It's good for everything. Get your rest. I know we live in a go, go, go world, but like, really, you need to take care of yourself. There are a ton of natural remedies. Exercise is great. Eat well. And I want to like specify for that, like, again, every single person and every single body is so different. It's really important to know yourself, because what might work for someone else might not work for you, and vice versa. So that's why it's really important to know, you know, your diet, what works best for you, how many hours of sleep per night is best for you, and all these other things. And then again, communicate. I cannot stress this enough. It sounds silly, but everything in my work boils down to this. I know it can be scary sometimes, but there are so many different ways to communicate with your partner and get help in learning how to communicate. So yes, next slide, please. Okay. Did you know experts say men score higher in libido while women's sex drive is more fluid? And sexual desire in women is extremely sensitive to environment and context, while it's more straightforward for men. What does everyone think about this? Again, very gendered language, but you're getting the vibe. Yeah, I think this one is interesting. Yeah, context, I think, is everything, especially nowadays. You know, really where you are with your mental, emotional, and physical health is really telling of where you are with your libido, for sure. Next slide. Okay, so relationships, communication, and intimacy, so important. Tips and tricks for relationship success. Again, communicate. And I want to also like preface that communication is really about framing, right? Like, you can say something a million different ways, and it's really about how you say it and how it's going to be received by who you're saying it to. That makes things land, you know, if that makes sense. Hopefully everybody is understanding that. But how you communicate is so important. I usually try to emphasize with my clients and friends and in my own personal life, you know, to come from a place of like love and compassion and care, because that is usually the most well received. Be realistic. Don't expect everything from your partner. No one is perfect. Like, we live in such an Instagram world. Everything is glossed over. We have filters on everything. Like if your needs aren't being met, leave, and of course, with certain things, absolutely. But we do have to keep in mind, this is where the empathy and compassion come in. People are people. We're going to make mistakes. We're going to have miscommunications, all of these things. I think it's really important that if you find someone that you're able to resolve conflict with and like have a successful relationship with, to, honor that person and celebrate your relationship. Set boundaries. Oh my God, my favorite B word. Seriously. Cannot stress this enough. Boundaries are everything. And look, I will say all of this sounds much easier as I'm telling it to you, but in practice, it's difficult. So give yourself some grace. Practice makes perfect. I will say that the more you do it, the easier it gets. And especially with boundaries. And look, setting a boundary with someone, that is more for you than anyone else. Sometimes people might not like you setting boundaries, but again, that's you honoring yourself, your needs, and prioritizing you. And that's all you can do at the end of the day, right? It's your life. Fight fair. When navigating arguments, let's just remember that some conflict is normal and even healthy. Again, yes, like conflict resolution is so wonderful. I mean, they say makeup sex is one of the hottest things for a reason, right? Because resolving conflict in a healthy way can really bring partners closer together. And the more that you're able to navigate these topics of conversation and these arguments, the better off you're going to be, especially in long-term relationships. Because let's be real, like I can hang out with my best friend every single day, and sometimes I'm going to get annoyed with them. That's just reality. That is life, Does it mean I love them less? Absolutely not. And look, I'm sure it's the same way with me. So keep in mind that we're all people, and just try to show up as your best self in those spaces. Next slide, please. Prioritizing pleasure. Oh my gosh. I wish someone talked about this to me when I was younger. Learning about the importance of pleasure can help alleviate some of the pressure and anxiety we all have to perform during sex. Oh my gosh. Performance anxiety. What a thing. One of the most relieving things I learned on my journey to be a sex coach is that pleasure does not always mean orgasm. And I used to put so much pressure on myself, and I know I'm not the only one, that I was like, I need to have an orgasm every time I have sex. Otherwise, I'm not having good sex. And that couldn't be further from the truth. I think that redefining our definition of pleasure is so important in terms of being able to experience all the pleasure that we can in our life. Pleasure extends outside of the bedroom in so many ways. It's leaning into our senses. It's leaning into our sensuality. It's being present in the moment. And that's really the only way, or one of the main ways, that we can let go of this performance anxiety and allow ourselves to feel. You know what I mean? Tangent over, but understanding pleasure can be extremely healing. Yes, especially for survivors of sexual assault. The better understanding we have of ourselves and our bodies, the better we'll be able to communicate our wants, needs, and desires in our relationships. I cannot emphasize that enough. And a great way to do that is with our solo sex practice. So I hope you're, doing that. Next slide. How do we separate sex from emotional intimacy? Ooh, yeah, this is a good one. Start by forming a healthy relationship with ourselves. Again, I am the queen of solo play. It is so wonderful. It is such a great way to know and love yourself. Having a strong sense of self can help pave the way to relationships where our needs are consistently being met. And I will say, a really hot thing to do with a new partner or with a partner that you've had for a while is to do mutual masturbation, which is, again, so fun. And by showing somebody how you enjoy getting off, you're also teaching them. So it's really, it's like, it's a great way to get them to learn and to make sure that you're getting off in the way that you enjoy. Number 2, clarify what sex means to you in order to gain understanding of what you're receiving from it, and how you choose to define it is up to you. There are so many different ways to enjoy sex and relationships. And one of my favorite things about being a sex and relationship coach is basking in that freedom. Like, we don't have to confine ourselves to strictly monogamy, only polyamory, or anything in between. It's really what's best for you and your partner or partners. Like, I really appreciate that people are leaning into this, is what I'm seeing recently. And just defining what sex is for them, what relationships are for them, and then intentionally partnering with people who can support that. It's beautiful. Number 3, accept that our needs deserve attention from the beginning of a relationship. This will allow us to build a long-lasting foundation of emotional intimacy. Again, very well said. I think being as honest and upfront as you can from the beginning, it's going to save you a lot of time and energy, and I think people really appreciate that. Knowing what you want is sexy. And if you don't know what you want, that's okay too. No shame in that game, but I think communicating along the way is great. And even if you're like, I'm not sure about this, but let's table it for later. Great. Next slide, please. How do I talk about STIs with my partner? Okay. Is emotional intimacy as important as physical intimacy for healthy relationships? Ooh, that's such a good question. And I feel like it's really dependent on the relationships, like some people I've talked to need emotional intimacy to have physical intimacy, period. Some people don't need it at all. It's really dependent on what works best for you, what works best for your partner. And like in any kind of relationship, there's going to be some compromise, and hopefully you're able to meet each other. And compromise is a beautiful thing. It's not about having to give up something or hinder yourself in any way. It's just about finding different ways to meet your partner that maybe you weren't sure of doing before, by yourself. So I think all of those ways are valid: emotional, physical, intimacy, whatever works best for you. And the more you communicate that, the better. Thank you for that. And how do I talk about STIs with my partner? Be honest about when you were last tested and ask when they were last tested too. I like to tell people, like, COVID is such a good excuse for talking about STIs. And I'm really grateful for that. Like, look, COVID has been, a whirlwind, but I really do appreciate and have gratitude for the fact that it has made us really prioritize our health and on all levels. And so it's like, hey, when was your last COVID test? Cool. When was your last STI test? Cool. Easy, very simple. And I will say, STIs are still stigmatized in some ways, but they shouldn't be. There's no shame around them. Like, what is shameful about honoring your health and wanting to have healthy sex with people? Even if it's multiple people, there's nothing wrong with that. I think the honesty is great. I think that having confidence about that is also really good, and like, instead of waiting for someone to ask you about that, it's okay to take the reins and be like, hey, like, my sexual health is super important to me. Like, is that important to you? Oh, it is. Cool. Like, when was the last time you were tested, etc. When you start to date someone, okay, yeah. Covered a couple of these things. Use protection. Okay, well, I would someone said to me it's shameful if it's incurable, but I would challenge that perspective because, STIs are incredibly common and there are tons of incurable diseases and there's not shame around most of them. So why would there be shame around having an incurable STI? And also, there are so many ways to have like safe and healthy sex with long-term STIs. So I think that that's something that has been culturally conditioned in our society. If you don't want to choose to have sex with somebody who has a long-term STI, that is fine, but I will say I firmly believe that there's no shame around STIs. Having protection is a great way to avoid having, any STIs, especially if you're dating someone new. I think that that's great. Condoms are wonderful. There are tons of different ways to prevent that. If you do find out that you've tested positive, tell your partners as soon as possible. This is a really hard conversation to have. I've had it before. And I always appreciate people that have had it with me. One, it shows that people care about you as a person. And I think that speaks more volumes than the actual STI itself, if that makes sense. I always have respect for people that come to me and be like, hey, or friends that I've talked to being like, yeah, this person told me, I went and got tested, didn't have it, or did have it. And thank God, because, or Bob, or, whatever you identify with. But, so I could go get tested and tell my partners, and so that we could be safe. Safety is always like the number one most important thing. And whether that's emotional safety, physical safety, health safety, prioritize that. Yeah, there are some questions, I think.
Yes, we had the one about oral sex.
Okay.
We kind of answered that, of course, it's better to help prevent infections. But like you said, there are so many different options for condoms. So,
okay.
Then, we're really working so hard to help decrease the stigma with these kind of STIs and even HSV2. It's something that, you might have outbreaks, but make sure you're speaking about this, with your healthcare provider. Like I said, there are medications in some circumstances you can take that can help prevent you from passing it along. So I think, as Shelby's been saying, and I'll let you speak to this too, Shelby, I'm sure you have some things to say, but, the communication, it's so important to make sure with your partners that you're communicating, openly and hopefully that, they're taking that and not making you feel ashamed.
And I think someone was saying too, like, if you test positive for something and you have shame around that, that's a very normal response, I would say. Like, it has been conditioned within us to have shame around these things. So of course, like, unpacking that is really difficult. I am definitely a resource to talk to. There are so many wonderful resources and people to talk to help unpack that shame so that you don't have to live with that. I follow some amazing accounts that especially talk to people with long-term STIs about liberating yourself from that shame, because that's not a defining factor of you. That is not at all. And it doesn't mean you're not lovable or sexy or any of those things. Like, you can have a very successful and awesome and super sexy life, even if you have a long-term STI. So if anyone wants to reach out to me after this, I would love to continue this conversation. I just want to advocate that I know tons of people that have long-term STIs and it hasn't affected their life. I'm sure at the beginning it did, but now it hasn't at all. They all have partners, they have kids, like, you can do it. And yeah. Next slide, please. So what are the benefits of speaking with a sex and relationship coach? Speaking with someone who specializes in this area makes it easier to communicate on topics about sex and relationships. Again, there's so much dialogue to be had about this, so many things to be unpacked. I'll say that even on my journey to be a sex and relationship coach, I went through the ringer. I had to unpack so many things myself and my experiences and the like, to get to a place where I was like, wow, okay, I'm feeling 100% with myself. I really appreciate these spaces because they're non-judgmental. You don't have anyone being like, oh, wow, or looking down on you from like your family or from any religious backgrounds or whatever it might be. It's really great to just have someone see you and validate you as a person, no matter what you're going through. And having a sex and relationship coach, usually we meet with people, we see what's going on with them in the present, and then form a plan with them about how they want their sex life to be in the future. And that is really fun and super exciting. So yeah, I'm just grateful to be able to help people open up and feel comfortable even discussing these topics. I know, like, it might seem easy for someone like me to talk about this, but it hasn't always been that way. And I just want to encourage people that, again, the more you talk about it and the more people that you trust to talk about it with, the easier it gets. And I promise you, the better your relationships will get, even if it's just with yourself. Next slide, please.
We have one more question, another question, Shelby.
Oh
Before
yeah.
I go in. So, do you only coach individuals, or can couples come to you together, or can they kind of do a little bit of both? How do you normally do
Oh
that?
yeah.
Yeah.
Both. Please. Oh my gosh, I love it. Yeah, I do singles and couples all the time. I think it's fabulous. And I will say, I've had coaches, I've had therapists, and I'm so grateful to have that third party. It's really nice to have somebody who's not in your immediate circle, who doesn't know you, to kind of be like the voice of wisdom and also encouraging and like be on your team, right? It's like it's not two people against each other, it's just everyone there working together. So yeah, I definitely do individuals and couples. Mhm.
Great. Thank you. Okay. So I will quickly go through some next steps because we have some great questions for Shelby at the end. So I want to make sure we get to those. So again, most STIs do not have symptoms. So we want to make sure that you do have multiple sex partners, that you are getting tested regularly. And like I said, what regularly means is different for everyone. So if you have questions, CDC has amazing resources that you can look into. We also offer consultations in certain states through our app. So if you want to take a look at that, we can certainly help you get a little bit of your history and let you know how often you should be getting tested. If you'll go to the next slide. So for our participants today, we'll be emailing you this promo code, but you will get a promo code for 30% off our sexual health test. So that's going to be our Simple 2, Standard 5, and Complete 8. Complete 8 being the most comprehensive test. It's going to be testing for chlamydia, gonorrhea, HIV, syphilis, mycoplasma, ureaplasma, Gardnerella, and trichomonas. So our website has more information on that. It'll tell you exactly what you're getting tested for, tell you when you should get tested, especially if you've been exposed. So, but like I said, if you still look at that website and still have questions, don't hesitate to reach out to us. You can book a consult in certain states, and we're happy to help you guys out. All right, let's go to the next slide. And I think we still have Shelby. Shelby, are you still on?
Can you see me? Oh my gosh, sorry.
Oh, there you are.
I don't know why my video went away.
We could hear you. We couldn't see you. Okay, so I answered number 1 already. So let's go to number 2. I'm currently in a monogamous relationship, but would like to try an open relationship. How do I broach the topic with my partner?
Ooh, yeah, this is a frequently asked question. And again, I think it's always very specific to the relationship dynamic. What I usually discuss with my clients is like, what are your intentions of opening up the relationship? And I think from there, you can really discuss like how you want to approach this. Again, framework is everything in terms of communication. So if you're wanting to open up the relationship, I would really, think about, again, what your intentions are and how that would affect your relationship and what you're really wanting your relationship to look like moving forward with that partner. But there are ways to do it, So there's not really like one,
I would imagine that
one line for you, but I think going through those intentions and then also, I guess like if you want to stay with your partner, really affirming that you know how much you value them.
Yeah, and I would imagine we do have Shelby's website over here in the chat. So, and I'm sure we can share it with our email too, just to make sure people can find that. But if someone wanted to talk to you a little bit more in depth about something like that, they could schedule an appointment with you and even get their partner involved so that you guys can have the conversation. So
definitely.
Okay, number 3, my libido has been unusually low at the moment, but I can't figure out the cause. Should I seek help?
I would ask yourself if it's something that's causing a concern, like if it's low and you're like, well, I'm just not feeling very sexual, but you're not really having a problem with it, then I would say you're probably fine. Like sometimes you're just riding the wave. If you're wanting to get more in touch with yourself, then again, I would seek out your solo sex practice and maybe redefine that or go a little bit deeper into what that is. I think it's really easily, especially during solo play, to get caught up in a routine, just like it is in most things. But if you're having a low libido, then maybe it's wooing yourself all over again. Or if you're having a partner, like seeing what you two can come up with. But I think unless it's starting to affect maybe your mental health or something like that, then I would seek some help. But if you're just having a low period where you're like, I haven't masturbated in a couple weeks, but maybe I should, then, tend to yourself. Yeah.
Yeah. And I just want to add a little bit there too. Like I kind of mentioned this a little bit, but some medications can mess with your
Definitely.
libido, like antidepressants is a big one. So just make sure, talking with this with your healthcare provider too, especially if you started a new medication and you notice it kind of happening kind of acutely, like all of a sudden, just make sure don't stop the medication, but talk to your provider about that too. And
Yeah.
then, maybe it's a medication, and it's sometimes just seasons in your life, like you said, Shelby. So, but yeah, great information there. Thank you for sharing that. I think we have time for our last one. So number 4, I'm in a very toxic relationship, but I'm finding it really difficult to leave my partner. What should I do?
Wow. This one is so prevalent, I think. It's really difficult to leave a toxic relationship. So I commend anyone that does. And, I think it's really easy for us to want to villainize people, I think, in our society these days. But leaving a toxic relationship is probably the best thing that you could ever do for you and the person that you're in a partnership with. And it is extremely difficult. I would recommend talking to a therapist or a trusted mental health professional and making a plan, a very safe plan of somewhere that you can go to get out of a situation like that. Because again, it's really hard depending on the circumstances. And it's really important to have support around you when you're going through something like that. But also, I would say to be gentle with yourself during that time. And also show yourself some gratitude, because again, like it's really, when you're in it, it's really hard to see what it's like from the outside. And leaving something like that can be extremely difficult, but I promise you it'll be the best thing that you've ever done for you. All you can do is choose yourself at the end of the day. And hopefully you can do that with the safety and support of your peers and trusted members of your community.
That's great. Yeah, so important to talk to someone, an expert, and that, like you said, making a plan. So make sure everyone, we do have Shelby's website over here in the chat. Make sure you guys are saving it. We also have it here at the end. So you can, schedule an appointment if you're interested. And also we have some information for support. Let's Get Checked. If you guys have questions, you can always go to our app and website. Shelby, do you have any parting words for us before we leave? You've given us so much great information. I've really enjoyed speaking with you, and I know everyone else has. So just, do you have some parting words for our attendees?
Oh, thank you, Ashley. It's been such an honor and such a pleasure. Thank you for listening to all of my rambles. And I just hope that everyone, if you're taking away anything, it's just honor and prioritize your sexual health. It is a radical act of self-love. And hopefully over the summer, you can add some more pleasure into your routine. I couldn't recommend it enough.
Perfect. Thank you so much, Shelby. And again, we'll be sending out the promo code for our test to get 30% off the sexual health tests. Thank you so much, everyone, for attending. I really enjoyed this. Bye, y'all.
Bye.